Hi, my name is Donna. I'm one of the care team nurses at Peak Vista Women's Clinic here with Peak Vista. I am also a lactation consultant, so we're going to learn about understanding breastfeeding. How breastfeeding works. So for babies, it really is important to breastfeed. It boosts their immune system, it enhances their brain development, it reduces risk of diabetes and SIDS. It can also help with GI concerns, decrease in diarrhea, decrease in constipation. For the mothers, it reduces the risk of cancers such as ovarian cancer, and for diseases, it helps reduce the risk of type 2 diabetes. It helps calm and connect with the baby. There are many hormones that are involved with breastfeeding that helps that mother control her pain right after delivery and connect with the baby in a calming, decreasing stress. It also can help you lose your post-pregnancy weight.
As a mom, to be able to feed my baby, it's amazing. You know, just to know that she's getting everything she needs from me is pretty cool.
Your breast milk is so nutritious and protective that it can lead to better health for you and your baby. Babies who are breastfed have fewer ear infections and colds, less diarrhea and constipation, and are less likely to develop conditions like obesity and diabetes than formula-fed babies. They are also at a lower risk of sudden infant death syndrome. Breastfeeding is important for mothers too.
Are you really hungry?
The longer a woman breastfeeds, the more protection she has against developing heart disease and type 2 diabetes, as well as ovarian and breast cancer. Plus, breastfeeding moms usually lose their pregnancy weight faster. And don't forget the strong emotional bond that comes with the close contact you get from breastfeeding your baby.
There we go.
You'll learn that breastfeeding creates this amazing, special connection between you and your baby. Basically, you're a superhero while you're breastfeeding. Baby has a cold, breastfeeding makes it better. Baby has an owie, breastfeeding makes it better. Baby misses you or is lonely, breastfeeding. Baby's tired but can't quite settle, breastfeeding is the answer.
The American Academy of Pediatrics recommends that for about the first 6 months of your baby's life, you feed them only breast milk and nothing else. No formula, water, juice, or solid foods, including rice cereal. They also recommend that you continue to breastfeed for at least 12 months, even after your baby starts eating solids, and as long as you both would like after that. While any amount of breast milk is better than none, the longer you breastfeed, the more benefits for you and your baby. With time, practice, and the support of those around you, breastfeeding will become easier and feel more natural.
My goal is to breastfeed for the whole year. I never knew that, during this time of me doing, something for him, that I was going to feel so proud of myself, actually. So it's something that's really been, good for both of us.
How your body makes milk. So your body produces milk. In the beginning, there's 3 different kinds of milk that will produce, and we will see that in the next couple of slides. The more the baby takes off the milk, the more milk that you produce. So babies will go through growth spurts, and by this I mean they'll cluster feed. They're going to want to take more milk off the breast. Your breast will compensate by making more milk. So if at any point in time during the breastfeeding process, if you feel like you're not making enough milk, keep that little nugget in the back of your mind, because it could be the baby's just going through a growth spurt. This is an example. The baby, like we talked about, the baby takes the milk, the breast makes more milk.
Breastfeeding really is amazing. Late in pregnancy, your breasts make small amounts of a thick, very nutritious milk called colostrum. This special milk is all your baby needs and is easy to digest, making it the perfect first food for your newborn. In the first few days after birth, colostrum changes to mature milk. You may also hear it referred to as your milk coming in. This mature milk is more plentiful and helps your baby grow and develop. Let's take a closer look at how your body creates this perfect food for your baby. Inside a woman's breasts are milk-making glands called alveoli. This is where your milk is made and stored. When your baby latches onto your breast and starts to suck, your brain sends hormones to the alveoli. Prolactin tells the alveoli to make milk, and oxytocin tells the alveoli to release milk. This release of milk is called the letdown reflex. During letdown, you may feel a tingling sensation, or nothing at all. Once the alveoli release the milk, it travels through the milk ducts to your nipple. The milk comes out of the nipple openings into your baby's mouth. The more milk your baby takes from your breasts, the more milk your breasts will make to replace that milk. Your body naturally responds to your baby's needs.
These are the different kinds of milk that are produced by the breast in the first week of post-delivery. The colostrum is the very watery kind of milk that comes out. You probably are getting it at the end of your pregnancy. It's very high in antibodies. Any antibodies that you have had, like for a cold or for the Tdap, will come across in this breast milk. Very little amount. The baby's stomach is very small, and so you make the right amount for the baby. Then the milk will transition on day 2 to 3 of the transitional milk. This is where there's still colostrum, but the more mature milk is coming in. Then by day 3 to 5, generally, the milk comes to mature milk. The mature milk is what will grow the baby. And there's 2 kinds of mature milk. There's the fore milk, which is more watery, has the same nutritional value, but then there's the hind milk, and that comes towards the end of a feeding. And that's the milk that's high in fat, and that's the milk that will grow the baby. There are special situations after you deliver. If you have a preterm baby, your breast will make the milk that that preterm baby needs. If you have twins, you can certainly breastfeed because each breast will make the amount of milk those twins will need. If you have surgery and you're taking some medications, make sure that you're telling the provider that you're breastfeeding so you have the correct medication. And then if you are have an overproduction of milk, or you would like to donate milk, there's the Mother's Milk Bank in Denver, and we at Peak Vista Women's can give you information on that. How to breastfeed. Well, one of the first things you need to do when you were thinking about breastfeeding is gather support around you. Make sure the healthcare provider that you're going to supports a breastfeeding mom. You can have a doula. This is a woman who will go with you throughout the pregnancy and also at delivery to help support you. Ask how breastfeeding and delivery, how that impacts that from your provider. You should have family that are supporting your journey to breastfeed, and making sure you're doing skin to skin right after delivery.
Even before your baby is born, there are a few things you can do to help get breastfeeding off to a good start. When you arrive at the hospital, let the staff know that you will be breastfeeding. Tell them that you don't want pacifiers, formula, or sugar water given to your baby unless it's medically necessary. These can cause problems with breastfeeding. Also, let them know that you want your baby put directly on your chest, skin to skin, right after birth and until the first feeding. Skin-to-skin contact is recommended because it helps your baby breastfeed better and for a longer period of time. You and your baby will also benefit from continuing skin-to-skin care as much as possible in the first few weeks.
Like just having that warmth on my chest and having her on my chest was really, it was a really good feeling. She was just doing those hunger signs. She was just like moving her head everywhere, just trying to look for something. The nurses definitely did help me a lot, and they just, you know, grabbed me, and she latched on right away.
Another way to get breastfeeding off to the best start is to room in with your baby. Keeping your baby in the same room as you during your entire stay at the hospital allows you to hold her skin to skin and respond to her feeding cues quickly. On the second night, you may notice that your baby is fussier and seems to want to feed more often. Babies do this mainly for comfort, and it's normal and temporary. The American Academy of Pediatrics recommends that healthy, full-term babies avoid pacifiers until breastfeeding is going well and your milk production is established. At that point, consider offering him a pacifier at nap or bedtime to help reduce the risk of sudden infant death syndrome.
The first moment realizing that I can breastfeed was kind of pretty exciting. And when I say exciting, it's all because of the doctors and nurses saying, you know, she needs this. This is what's going to help her. It's going to help her grow.
If your baby was born early or with a medical condition or can't breastfeed right away, your breast milk is still the best food for her. Start pumping your milk or removing it by hand as soon as possible after delivery to protect your milk supply. Ask your nurse or lactation consultant to help.
Here, and now try pushing back and squeezing. There you go. You're doing amazing.
This milk can be provided to your baby in various ways until she is able to feed at your breast.
Benefits to the skin-to-skin that I just talked about is that it helps that baby transition from being in a nice, warm, watery environment to out in the air. It likes to hear your heartbeat. That's what's very comforting to them. The skin-to-skin can be with you or it can be with dad. It helps regulate their temperatures, regulate their breathing, and it also helps you, mom, when you put that baby skin-to-skin to start releasing those hormones.
Holding your baby skin to skin with no clothing or sheets between you gets breastfeeding off to a great start.
Yeah, we wanted to do the skin to skin because I've read a lot about how good it is for baby, but it's just a really good bonding moment for her to just come right out and be with you right away.
Skin to skin contact triggers the hormones that support breastfeeding. It also helps babies latch on and breastfeed sooner, which leads to a healthy milk supply. Skin to skin keeps your baby warm and comfortable and helps him adjust to life outside the womb, so he tends to cry less and is less stressed. It may even impact his future brain and emotional development. If you have a cesarean birth, ask to have your baby put skin to skin with you as soon as possible, either on your or your partner's chest or held cheek to cheek with you. When you hold your baby skin to skin, lie back and relax with her close to your breast. She may move to latch on by herself, or you can help her.